and hopefully get this all up and running without any difficulties. So, without further ado, I would truly love to bring on my greatest friend and longtime mentor as well in the cupping world, Shannon, the CMT, literally the international cuppist of the world.
Hi, Manny. Thanks for having me. That's quite an introduction to follow up, but yeah, you kind of explained who I am. I am an international cupping educator, a massage therapist here in the United States, and honored to be here and answer some of your questions about one of my favorite subjects.
Nice. And when you think about it, how, when you've traveled all over the world, how many places have you been to? Can you count on your hands?
I can't.
Oh, hey, there you go. And how far do you see yourself going? Like, do you want to truly make this capable to, when we talk about international, is it something that you want to continue to make sure that the practice keeps being taught?
Yes. So it's interesting when we try and count the days and the years or the travels. I've been traveling regularly and consistently for more than 20 years in this educational field.
Okay.
And there's always interest in different countries and different areas of the world. And obviously, every time a new contract opens up, I announce it, and we have new countries that are coming in the future. And I'm thrilled to say my first book is available in several different languages around the world, an international bestseller. I'm very proud of that.
Nice.
And yeah, I mean, it's constantly growing. The enthusiasm and curiosity of the subject, and most importantly, the results speak for themselves. And I'm happy to share it with anyone who wants to learn about it.
How the best way to word this question? What do you find when you bring somebody into a class and they're able to teach or practice what you love? What is that reward for you?
So many different ways. Ultimately, my biggest goal as a teacher is to instill the knowledge and the full potential of what cups can do. So I think one of my favorite takeaways is it's like the full spectrum of body work, whether I get someone who's brand new to body work,
right,
and just totally immersed in learning, and they're fascinated by what cups do, and seeing them just get the excitement that continued from their schooling or their first years. But then the other side of that is I've had practitioners many years longer than I have. I've been in body work for 27 years. And people look at me like I'm a youngin' in the field, but then they come to learn cupping, and the rekindling of enthusiasm that they have, because in any job you can feel the longevity, and sometimes you question, like, what am I going to do to keep going or add to what I'm already doing, which is great. That is a huge takeaway for me, because I just had a student in my class last year, 40 something years of massage therapy.
Nice.
They had like they were glistening in their eyes, just so excited at how they were going to save their body energy and
Right.
what they could offer their clients, and that was so fulfilling. Yeah.
Okay, fair enough. And when you find that person that absolutely takes this and explores into it, what do you find the biggest takeaway is from all your classes?
I like the individuality that comes, because
Okay.
the emphasis for me as an instructor is safety first and foremost. Yes, you need to know the science of it, but with so many subjects, there is a huge misunderstanding of safety, and this is definitely one of those. So I do like seeing how people, as long as you understand the safety and the efficacy of what true cupping or cupping body work or cup therapy, however we're going to define those terms maybe later, because we are, I teach in many different professional scopes of practice, and so this term is interchangeable for different people. I like seeing how people take it away and make it their own, like you, Manny. The things that you've done with cupping, extraordinary. I love it every time I see it, and every time I've had you work on me, it's awesome, and it always yields great benefits. So there you go.
Thank you.
Mhm.
So we're going to get right into the Q&A now, people. And again, thank you so much, guys, for joining me and Shannon for this next little while. We're going to do our very best to give you the best education that we can possibly do for you. So, Shannon, what is it that inspired you to specialize in cupping, and what got you so interested in specific modality?
Well, the long and short of it is my personal experience, which is, again, something that I hear from so many students because when I first took the class,
Right.
it was one of my first continuing ed classes, and it was wild. There were fire cups, which aren't legal for massage therapists. There
Correct.
was a
Only
lot of
acupuncturists, yeah.
Yep, there's a lot of like elusive information, and I was in my own body dealing with a lot of soft tissue pain and scar tissue from a younger injury accident that I talk about in some of my classes. But the sensation just, it was unlike anything I'd had, and I just came 2 years out of massage therapy school. So it really did make me ask more questions than answers I got. And
Right.
immediately I just jumped into the research. I was invited to be an instructor, and I just kept studying and just kept researching, and that has snowballed throughout the years, and it still is one of the greatest ways I treat myself.
Okay.
And I love that I have that sympathy with people in pain. So yeah.
When you so you said it was just out of 2 years after massage school. What was the education like then compared to 20 years now? Was it something that was extremely hard to find? Was there actually, when you came out of it, was it even taught back then in massage school?
So no, not at all.
Okay.
It was definitely I was looking for a reason to go visit somebody in Las Vegas,
Okay.
and that's where the class was being held. And so, you show up, and it's a mixture of body work, which is great. That's how my classes are. But it was so um, how do I say, like, it was randomly organized education, but there was a flow to it. And
Okay.
so I kind of found my own way. And then when I began teaching, I started making more structure. And the research at the time was, again, almost equally as elusive because the subject had always been discredited for its validity due to the way that cupping kind of declined into obscurity when so-called Western or modern medicine came in because they approached the body differently. So you had to go kind of digging through research to get valid information
Right.
and to get trusted sources. But with time, it's incredible because so much has come out, and people do see that they need to know that tangible evidence, the how, the why, the what, and now that's all available. So that's exciting as an instructor, and I am constantly updating paperwork, changing information for the better, right?
Right.
And just always striving to improve the way people learn the subject as much information as possible now.
Yeah. Yeah. Big time. I love that. I actually didn't know that cupping back then wasn't even I guess it wasn't even a thing.
No, that's why we could do fire cupping as a massage therapist. That is not legal
Interesting.
in the United States at
It's not
all.
even here. No, it's only in Canada. Only acupuncturists are allowed to do it.
Exactly. And I am I am approved as an NCCAOM acupuncture CE provider.
Right.
And I'm the only massage therapist in the United States that can do that, not being an acupuncturist, because of my wealth of information safety
Yeah.
and the advocates of acupuncture worlds that have said,
Right.
no, she knows cupping. Let her teach us CEs. So that's huge. That
Yeah. That is huge.
yeah,
Congrats.
we discern. I don't teach fire. It's not the cup you use, it's how you use it. So if you're an acupuncturist, you know how to use fire cups. Let me show you what to do with it, maybe a little more.
Yeah. No, it's very true, and it's a lot more riskier too.
Woo!
So
Fire
yeah,
burns.
fire burns. Yeah. Yeah. We won't get into that, but I've had a bad experience. So,
We all have,
um,
unfortunately. I'm sorry.
yeah. Yeah. Alrighty. What is the benefits of cupping after a workout, and is it better post or pre for best results?
That's a very broad question
Yes.
because there are so the benefits, I'll say it in two parts because that's exactly what you asked. There are benefits to both pre and post.
Right.
And that's comparable to like sports massage. There's benefits entirely separate pre versus post, but they're different methods of application. That's the biggest thing to take away. So the pre, I'll lump this in with information that we offer our physical therapy or PTA students. So the methods of application are going to be more stimulating, more invigorating to stimulate the muscle, right?
Right.
To invigorate the tissue for maybe the lifting, for the fast exertions. So the method of application will be great to so-called warm you up and jump right into an event. Whereas post event, it's going to be more relaxing, more maybe compression, sedating, soothing. And
Yeah.
you're going to want to have the time after that treatment to fully process the relaxation that you've instilled, the proprioceptive responses you've evoked in the muscles to allow for the greatest response after an exercise. So there are pre and post benefits, just depends on how you use cups.
And when it comes into that, if we say, for example, is there a time frame? So I know there's many time frames of when, hey, maybe if I'm training in the morning, should I get cupping the night before, talking about before, and should I actually allow my muscles some recovery time? Like I shouldn't just go for a training, take a quick shower and get some cups on me, or should there be a period of time that you actually allow the muscle to kind of go through that phase of recovery before actually getting some treatment?
So yes, because
Okay.
there's so many things to consider there. The night before, if you're exercising and you sleep, that's the reset button. That's, in my opinion, no worries. If you're going to go right from, like for you, I know that you do
Yep.
personal training and then they get right on your treatment table. If someone has cooled down,
Yep.
how hydrated they are,
Yep.
how maybe overly exerted their muscles are, what type of body work are you going to do? Not as strong or aggressive if they've really worked the muscle, but you want to
Correct.
instill relaxation. So the timing is really relative to the person, their hydration, their muscle health, their experience with body work. All of this is relevant. And also, in general speaking, I tell people if you have cupping and you want to go do something, more rehabilitative afterwards, give it a few hours just so your circulation recedes, the soft tissue relaxes, you've hydrated, cooled
Yep.
down,
Yep.
and then go ahead with your normal, functions and what you want to do.
Yeah, I'd agree.
Mhm.
Big time. Number 3, there's many different types of cupping. We already brought up fire cupping. So from fire cupping to needle cupping to vacuum cupping to hashi to cupping and even machine cupping, which I know that you actually do have. Can you elaborate on maybe some of the differences between, and maybe what would, if someone's looking for a specific type of cupping, what route would you always recommend?
Okay.
That's a
So,
big one.
yeah, that's a huge one because there's so many ways, right? And I said this before, I'll say it again. It's not really the cup you have, it's how you use it and what your
Right.
goals are. So for the base level, you talked about fire cupping. We already talked about that. Acupuncture,
Yeah.
scope of practice.
Correct.
Wet cupping or the bleeding cups. That is again, acupuncturists can do it. They can cut the skin. And some of the more alternative health, like hijama practices, that's where the bleeding comes in.
Yes.
As a LMT, we don't cut the skin, we don't bleed people. We're working more with the body's disposal through the lymphatic system, right?
Right.
And so that can be a whole variety of cups. So the bleeding cups are usually glass.
Yes.
The fire cups are glass or bamboo. We have silicone squeeze cups that everyone's really familiar with nowadays. They can
Yeah.
do muscle work, they can do body contouring, cellulite, you name it. This is a cup. It's easy. You squeeze it on, you squeeze it on, you squeeze it off. Really easy. The vacuum pumps that we have a hand pump, we have a cup. This is how you extract the air to create the suction attached to the skin. I have a compatible hose, so I can do a lot of good movement with it. It's great for self-care as well.
Yeah.
But you would want to have a better level of training with the pump cups because they have a very broad range of suction pressure.
Yes.
And to continue that subject, so the cupping machine, this amazing machine, and I have it over here in the corner, but I don't want to pull everything over. The cupping machine is especially good for the professionals, the ones who've hopefully had cupping training, the ones who are in clinical practice.
Right.
I use my machine almost every day because I use cups every day. So, for example, the face cupping that we do, you want
Right.
to maintain light suction. And with some of these lighter face cups, it's constantly squeezing my hand, which can be fatiguing.
Right. Yeah. Big
And
time.
so to that point, if I'm clinically trained and I'm doing cupping as much as we do, the machine makes sense. And
Yes.
so, I teach a cupping class on strictly the machines now,
Okay.
that you have to have the prerequisites of our fundamentals and therapeutic cupping lymph drainage courses, and then you learn how to use the machine. And I am recording a video now that'll be available all over the world because people are buying machines, whether it's
Yeah.
digital or analog,
Yeah.
but they don't know how to use it, and they're again causing harm, which and the video will be like, here's recommended pressures for this type of treatment versus that type of treatment. It's just a different clinical level. And to that, I'll say also, I work in a very niche field of the medical community,
Okay.
whether it's post-surgical of one reason or another, and they need that objective information. Like, I've had 5 micrograms of pressure for 2 sessions, and I was able to increase it, so on and so forth. Versus,
Right.
with this, it's just light, medium, or strong, which is not
Yeah.
bad. I used it for years, but it's
Yeah.
just with time comes progress, and so too does cupping equipment.
Yeah. Exactly. And there is definitely a much more of a medical side to it when we're talking about the machine pumps.
Yep, and you mentioned the Hachi cups too. Those are micromagnetic cups. Magnets are
Nice
amazing
memory.
therapy. I did, yeah, I tried. I had an experience to work with an orthopedic who had a magnet research facility, and he welcomed me to his practice because I'm using the little Hachi magnets for pain
Yeah.
management, whereas he has 4 physical tons of copper, and I'm seeing the most amazing healing with that magnet. So we have little cups with magnets, and most of our pump cups have removable magnets that people don't know what to do with them. So I
Yeah.
started teaching a class with that, and it's fascinating what comes with just those. The gauze is different of one to another, strength, etc. So
Yes.
cups are so widely varying. But
Yep.
I love clear cups because I want to see what's happening inside when
Yes.
they're applied. So I will always advocate, no matter what cups you have. Silicone ones come in all beautiful colors now, but I want clear because I
Yeah.
want to see what's happening.
Yep. Yeah, I'd agree. I think I don't know if you still use it, but the cup is the window into the body.
Absolutely. Yeah, I call it a looking glass in my papers. It's a term that makes sense because you can see sometimes something surface,
Yeah.
and then when it goes away, you understand that even there's not a cupping market. I know we're going to talk about those. It still is indication of what's happening under the surface skin, and that's
Big time.
crucial when it comes to therapy and recovery.
Big time. Yeah, I couldn't agree with you more.
Mm.
All right, number 4. So I've had some clients ask, say, like, I've had a surgery a few years back, and it has truly limited my range of motion and overall mobility of the said joint. Can cupping help with scar tissue around that joint?
Totally. Scar tissue is one of my favorite subjects with cupping. I have a course specifically just pathology scar tissue. And
It's a
it
great course.
does it does require some basic cupping training, which is why it's the 4th in a series with us.
Yes. Yep.
When you understand what scar tissue is consisted of, what the healing process is, and how that can affect, for this example, a joint.
Right.
The way that scar tissue forms, how it can restrict the compression that happens, and if it's around a joint, that limited range of motion, the negative pressure of cups. That's my favorite way because we shift the paradigm of thought with the body. Rather than pressing on something that's tight, we're making space. And then if you can manipulate that, you allow for that range of motion to be not only restored, but perhaps enhanced.
Yes.
However, my asterisk is with scar tissue, you have to wait a certain period of time before you start working on it because you can make the scar tissue worse. There's a
Yes.
certain processing period that is crucial to avoid manipulation. And you could also hinder their overall healing.
Yeah.
So we've seen some profound results, time in, time out, years in, students across the world. But it's all about that timing and
Yeah.
logical application.
Yeah. Yep. And we won't get too much into that. If you guys want to know more, honestly, guys, do the course. I did it many years ago, and I have helped many clients, and even myself. It doesn't even have to be scar tissue per se, where scar tissue is when you actually have a laceration. It can even help with densification. So like a knot or an adhesion, there is time and pressure for that of when that can be beneficial.
Totally. Yep.
Number 5. So how soon can cupping be done? Oh, talk perfectly done. Done on an injury in the gym, and can cupping be used on acute chronic injuries?
Okay. So acute chronic injuries. Those are that. So
A little break in there. I should have given you a little break. Yes.
Yeah. Okay. So I'm all about timing, right? So
Yep.
scar tissue from surgery, laceration is different than an injury.
Yep.
And the timing that the body takes for total inflammatory responses is average 72 hours.
Yes.
So you'll want the body to do what it does. Because if I, for example, start working on an acute injury 24 hours after, I am not only inhibiting the lymphatic reaction that needs to do what it does. If tissue is torn and you have soft tissue that's torn and I put a cup over it, it's going to tear it more.
Yep.
So after 72 hours, the way that we approach acute inflammation is different than chronic inflammation. So acute, I want to support the lymph drainage. And when it's fully healed, that injury, there's a different way to approach it. Okay. But chronic injuries, like for example, I talk about tendonitis and tendinosis in one of my classes because they're different, but they sound the same. And you
Yeah.
have what is called an acute flare up, right?
Okay. Yep.
So when you talk about that, chronic repetitive injuries, they have kind of like a recurrent inflammatory situation happening. We can break that cycle when you're allowing that local chronicity of soft tissue dysfunction,
Yep.
the space to have cupping support the microcirculation to break up the adhesions that are keeping that vicious cycle of ischemia. And so the chronic sees profound reactions, cumulative, lasting, and corrective, restorative. So it's different. Acute, we want to wait at least 72 hours before we start working around the area and further for on the area. Chronic, I'm going to approach that when it's not in a state of acute inflammation and really work to help restore and reestablish healthy soft tissue.
Nice. And so, guys, we're talking a little bit just to give you guys some background about the lymphatic system and what it actually is, because cupping does work, I would say, hand in hand with it. The lymphatic system is essentially your body's way of deposits and garbage waste system. So it is basically a fluid inside our body that basically helps transfer all the good stuff and the bad stuff to where it needs to go. We have 4 chambers in our body. They're known as your axillas and your inguinals. And so when we're talking about where to move stuff, there is appropriate times of which way it should go. So when we're talking about working with lymph, cupping can help with that. So when we're trying to aid the lymphatic system or trying to help remove junk, the lymphatic system is where we try to put it to and help it out. The body does know its rhythm, but sometimes when we have those stagnations or densifications, so injuries or bangs or bumps, there's sometimes blockages, and that's where cupping can kind of help out. Is that a good way?
Yeah, and may I say one thing also?
Absolutely.
That was a beautiful way to describe what the lymphatic system is. It's imperative when we talk about this timing. The lymphatic system is part of our blood circulation, right? It's all about it initiates inflammation to heal an area, but it also is responsible for the resolution of that inflammation. So it is all about fluid movement and timing. And cupping is so influential on fluids of the body, and we open up the space where it travels. So when Manny's talking about the axillary and inguinal regions, the watersheds that drain the body naturally, there is all about timing, and that lymphatic system, we are influencing it exponentially.
Nice. And again, guys, Shannon is also a certified lymphatic drainage therapist as well, correct?
Yes, sir.
Yeah.
The way that cups affect the lymphatics, it constantly surprised me, and I had basic lymphatic training, so I just enhanced my lymphatic drainage training to amplify my cupping therapies. So there's that.
And guys, being even so, I'm a fascial therapist. Shannon is a massage therapist. These are great. Like cupping in general is a great addition to any type of practitioner that's a body worker. But just make sure that when you go to somebody, they have an education, because there is, as we come along these questions, there is going to be some contradictions that we should always be aware of. And when we get into it, oh, this is a great lead-in. Number 6 is there's a lot of online videos of full body cupping with being stretched. Is this safe or should it be avoided?
Oh boy. So in the age of online education, I can say that while I've been in this cupping education industry since, a few pages of paper and fire cups to now, um, I think online education's so important. And it's
Yeah,
good to see some things like the cellulite contouring that people are doing with cups,
yeah,
but they're not giving the full detail. And if I
yeah,
was to watch that as an uninformed practitioner and take that to my clients who might have a circulatory issue, I'm going to cause harm.
yes,
So, online education, depending on what you're seeing, I think you have to take it for what it is. It's a video to watch. And if it really fascinates you and it's so therapeutic, go to a live class. I
yes.
personally, our company is created to never offer online education. The only video I'm offering is how to show a machine, but there's no like instructions on how to do body work, right?
Yep,
So when you see these amazing videos of cups and they're stretching the body, it's because they're trained with fascial mobilization. They know how to passively or maybe actively stretch a body, and they're putting the cups on strategic placements, these fascial restricted areas,
yep,
and moving the body. So it's beautiful to see and it really inspires people. But I've also seen clients who do it and they bruise themselves and they're
yep,
hurting maybe their husband, their wife, their partner, their family member because they're doing it. Like I
yep,
had a client that literally back in the day bought the cupping machine off Amazon and they destroyed some blood vessels. And so I bought it back from them. And that's where I get made up made the decision to make an online video about the cupping machine. So I'm like, I'm not
smart.
teaching you how to do cupping, but I'm like, this is the machine. These are what the suctions are recommended for. Please be careful.
Yeah. Yeah, no, and I will actually add a piece into this. So I've seen stuff, guys, on Instagram where an entire back is done. I mean, from top of the traps all the way down to the calves. There's not one spot that wasn't covered. And then they're making the client go through touching his toes, twisting and torquing of the spine, twisting and torquing of the legs. Guys, this is when we're talking about cupping, there is also going to be blood pressure changes. And when you're having somebody go up and down, there is changes. You try getting off of the floor, try twisting and touching your toes. When I utilize any of my fascial work, I have maybe 2 or 3 cups on the outside, say, of a glute or the outside of the hip, and I'm doing slow movements with that hip joint to get stagnation out and to get fresh nutrients into that zone. But we're not doing rapid. Like there's a lot of fast twisting, forcing the person to bend, and the cups are flying off. Guys, it's absolute garbage. So again, learning online is awesome, but if you're interested about something, reach out to people like us to actually be like, and you know what, it's what my clients do. They'd be like, Manny, is this safe? And I'm going to tell you, no, it's not. Right?
We're in an age of give me 30 seconds of a video and wow me. So that's a fast shock
Entertainment.
factor.
Yeah.
I
It's
will
clickbait.
never see that. The shift in blood that one cup does. So maybe that person that you're talking about had great healthy constitution, regular cupping, muscle activity. They were probably having those responses that you talked about, maybe some dizziness, the blood pressure changes. Like that wow factor is not something that we should do with cupping, in my opinion.
I
And
agree.
those are professionals that understand what's actually happening in the body.
Yep, completely agree. And guys, yeah, again, this is my opinion on my end, and as Shannon just said, it's her opinion on her end. But you know, we've both been cupping between both of us, Shannon, I think we're over 35 years between both of us. So
we're not that old, Manny. I mean, yeah, we are.
so, but guys, we've been doing this for a really long period of time, and thanks to Shannon, like I've been able to cup for over 10 years now. And I can't thank you enough, Shannon, on that. And I've been able to help so many of my clients to really see progress, just as Shannon has. And guys, we do it to ourselves too. This is not just something that, you know, I do it daily on different parts of my body. I think Shannon, you do it daily yourself.
Almost daily, yeah. Crazy schedules being what they are, but there's regular self-care.
Big time.
It's part of who we are.
Yep.
And we know the benefits.
Big time. So, on that note of doing cupping, I don't have it. I have some on my back, but I'm not going shirtless for you guys. Not that type of show. How long does cupping marks last? And what is the difference between a cup mark and a bruise?
Okay, so big question. Cupping marks can last from a day to a week, hopefully less than a week, because it depends on the person's healthy constitution, their level of hydration, the darkness of the cupping mark, and their experience with cups, in my opinion. Because, so let's compare this to a bruise. If you have a bruise, it takes an average of 7 to 14 days for it to actually dissolve, right? Now, this is a huge point of question or contention depending on who you're talking to.
Yep.
A cupping mark is spontaneous in nature and never forced. And some people are learning cupping from those who will say you have to have a cupping mark to get a result, which is not true.
Correct.
The most amazing things happen without ever marking the body. A cupping mark is spontaneous in nature. It's indicative of release in the body. And when that happens, I could give you 1,000 examples, but I'll try and choose one that's relevant. I had a new client. The third time I worked on them, they shared a history of a torn bicep.
Okay.
And they were having limited range of motion in that arm. We had a cup placed on that bicep where the head was shortened and the extension was limited. Very gentle extension. I checked in to make sure it wasn't painful. They said that feels amazing. It's not uncomfortable at all. The mark came up like purple.
Yeah.
And no pain to touch it.
Yep.
So now, whether there's stagnation of blood from the old injury or the necessary micro traumas that will break up the fascial adhesions to instill a healing process where that, you know, the collagen fibers are restored, the healthy tissue, the angiogenesis is reestablished in the area of deficiency. I can't tell you without a sample, and I'm actually doing clinical sampling this year because I have time to.
Nice.
So, but every cupping mark is different, right? So that was purple. That lasted for 6 days.
Yep.
The next time they came in 2 weeks later, I revisited it. The cupping mark was gone. It was red.
Okay.
It lasted about 4 days. And then we did a couple more sessions, barely any speckling now, dramatically increased range of motion. The bulking of that muscle has elongated, and they are so confused because everyone said it was a bruise, and the client was like, no, that's a cupping mark. This doesn't hurt. And they just fade away, whereas bruises change in their shapes, the lymphatic system dissolves them, and they are painful to touch. So that is the big delineation between cupping mark and bruising.
Nice. And I'll say, just to extend to that, it does depend on someone's sleep, someone's nutrition, someone's hydration,
absolutely,
someone's stress. Guys, like there is, when we look at, because I hear it a lot, oh, well, cupping is bruising. It's not, guys, because you should be able to, can your skin be tender and sensitive? Absolutely. Everyone's body is different. Like the individualism of how a person's body, some people can scratch their skin and they get red marks, right? It all depends on how the system responds. What I say as a rule of thumb is 7 to 10 days if somebody has sensitive skin. But I have cup marks, and I've had, just like Shannon said, I've had some people that don't get any cups. And it's like, we did a whole session and there people are like, oh, my cups disappeared. Is that a bad thing? I'm like, no, it's absolutely not. We don't always have to have a mark to be prevalent in a result. Sometimes we're just breaking it down. And I think there's, when we talk about it, because I didn't ask this in the question, but it's a good time to actually throw this in, is the timing of a cup. How long should it be in? And now this is different for different practices.
So I'll say this too before I go into the timing of it all. I just had a student in my last class, a physical therapist, brilliant, brilliant, questioned me endlessly, and I loved it because I had the answers. because they were doing cupping that they learned from a 1-day class, and they didn't have answers. They just got covered in all these marks that lasted for 10 days, and they were sore and they were confused.
Yeah.
So they also said, well, I recovered. So you recover from a bruise, who cares? I don't want you to be in pain. This is
Wow.
never a no pain, no gain situation.
Yeah.
And far too often when you get those marks, those are bruises because they're forcing soft tissue trauma. Think about it. A bruise is from hitting the body,
Yeah.
blunt force trauma. So if I put a cup on and I rip the tissue, is that not negative pressure, soft tissue damage?
Correct. Yep.
So there's that, right? And so the timing of it all. I mean, that is again left to the discretion of the person you're working on, their healthy constitution. Legally speaking, I have had meetings with different boards that we're certified by because
Right.
I was questioned by one instructional company says there's no time parameters. You just do what's good for that person until you see a mark. And then I get the students
Sorry.
that come in that have like these marks that lasted 2 weeks. And I said, I'm so sorry you had that experience. Thank you for coming to the class with me. We're going to give you safe parameters. And I do say this is to your professional discretion. But so the acupuncturists, when I told them that there was an educational company that says you can put a cup on for 20 minutes, no problem. The director just kind of looked at me because it was a video conference and they said, really? And I asked who it was and I shared. But they said that's just common sense. There is no specific time parameters legally written down for how long you can or cannot leave a cup on. It is strictly common sense. So we recommend 1 to 3 minutes, no more than 5. You can remove it. You want to assess the tissue, the results from that stationary cup, and maybe reapply it. But there's also indications of when you are done using a cup. And we go over that, like temperature, sensation, circulation, density, all of that. So, as a massage therapist and I do CEUs, I'm continuing education for massage, acupuncture, athletic trainers. Everyone understands it's common sense. So when you get people that say, oh, well, I can have it on for 20 minutes. Well, maybe you've been getting body work once a week for the last 10 years. What about the person who it's their first time? Are you going to do it to them?
Yeah, right. They'll never come back.
We have the pictures of what happens when that occurs, and it's heartbreaking. So we're here to do no harm and help people feel better.
Absolutely. Mm-hmm. This one's going to be hard not to go, but maybe the top 3 or top 5. Are there contradictions for cupping?
So many. Okay, so in the basic and in the very few, right? Because I offer a couple of pages of this.
I know. Yeah.
So we're never doing it over exposed blood vessels. For example, like veins are naturally more superficial than arteries. We can see them. Like you can see some up here in my brachial plexus if you were seeing my pectoral region, which is a very common pectoral muscle insertion, a lot of tension and anterior shoulder compression. But if I have a clear cup on and I see the veins start to change in position, remove the cup. And then strategically replace it because then we're causing vascular damage. Okay, so, and to that point, never over varicose veins if you're working on the legs. Stay out of endangerment sites, especially with stationary or movements. Never over acute injuries and never over open wounds, right? No seeping, no blood, no injuries. And I am very cautious in the stomach. I do wonderful. We teach amazing abdominal cupping day 1, but we also we help you understand what's the abdomen. Your organs are there. I work with visceral manipulation. There's a time and a place to understand when you can and cannot use a cup. It's not one cup placement for every person. So there's lots of safety. Mm-hmm.
And guys, if you want to learn more, Go to her courses.
Thank you. Oh, and let me say this though. So people with blood considerations, if they're on blood thinners, they're not going to have the same application as someone who is on Manny's table as a client, right? If they're not taking blood thinners and they have healthy circulation, they're used to body work, their cupping is incredibly different than the person on blood thinners, but the person with blood thinners can still have cupping.
Yep.
It's the method of application and what you have to pay attention to.
Yep. Big time. Big time. And also, guys, because I get this question a lot, can you cup the belly button? No, don't cup the belly button. Just leave it be. You should be surprised how many times I get asked that question.
It's an open orifice into the body. Let's just leave things where they are.
Yes. Alrighty. Coming into number 10. How old is cupping? We talked about the hieroglyphics earlier. And I've also seen it in Greek art depicting cups, like the actual the older. It seemed like it looked like it was marble or clay. And was the practice the same, and the purpose was it the same?
So fascinating. There's no point in world history that I've found in all my research that says where it started. Like there's no pinpoint to drop it on the map, right? But so I'm looking at one of my papyruses that has the surgical instruments and cups are in the bottom corner, right? It's magical. Yeah. Ancient Egypt in the Ebers Papyrus talks about using cups to heal a whole variety of ailments and enhance the healing crisis. They would use them for musculoskeletal issues, digestive, gynecological, headaches, nausea, you name it, they were using cups. In ancient Greek practices, Hippocrates and Unani medicine, they studied at the Temple of Kamambo where the surgical instruments are in ancient Egypt and created the balancing of the four humors of the body. They used the ventoses, the cups. It's amazing. My oldest client that was 96 before she left us, she came to me because she had cupping done as a child by her grandmother when she had a cold. And she's like, I'm Greek. Of course we use them, right? There is history in every culture. The Chinese culture with the ancient practices of acupuncture, cupping is one of the many tools they use to move the chi. Ayurvedics use it in prana stagnation. You know, every single culture of the world has something written around the globe. And in the Americas, there's history within the medicinal practitioners of our cultures, our ancestors of these lands before we walked around on them as well. And I love that I get to work with some of those people. In Guatemala, the people that I worked with when I first went and taught them, they were so funny just looking at me like, what are you going to teach us? I've been doing this for generations. My grandmother's grandmother taught me. But then I pulled out the silicone and they were using glass and ceramic jars. So
yeah.
The evolution is fascinating. It's been around since humans have learned the magic of therapeutic touch.
Oh, I like that. That was a nice one. When we come into it, I've heard that cupping can help me lose some belly fat. And is this true, especially around my hips, my hamstrings, all the sweet spots of where we hold that stubborn fat?
So I laugh because it's one of my greatest questions I get on a regular basis.
Same.
And because, yeah, I mean, honestly, I don't know much that cups can't be utilized with to be an adjunctive complement to any kind of body work. So, for example, I'm going to give my shame plug, right? So because this subject got so popular, one of our classes that we teach, we do show the therapeutic cupping lymph drainage, how it's everything from muscle recovery to body contouring. And especially in the abdomen, it's important to understand that the adipose in the front of the stomach is easily inflamed, so it should be approached differently than the rest of the body. But cupping, you can see so many people online now doing cupping for cellulite and contouring. Yeah. So I was asked to write my third book and it has face and body cupping on it. So I go through the full sequence for the professional practitioners because you can literally see some of the sculpting in the midsection. And I show that in, the active classes when we're demonstrating and how it understands that stagnant lymph and in our midsections where the hips, the glutes, the obliques, the back, the abdomen, it all drains into that inguinal space you mentioned earlier. And when we're having cups to soften what's stagnant, loosen adhesions that inhibit the drainage, and we're boosting the circulation, and think about it, negative pressure, all those cellulite dimples that restrict things to move through. Let's open up the channels and sculpt the body. And it happens
Absolutely.
every single time. And it feels so much more comfortable than some barbaric positive pressure body sculpting therapies I've experienced, because I go out and I experience them, so I know
Yeah.
what feels good. And you
Yeah.
should too, right? If you're the
I do.
therapist who's going to do it to somebody, you
Yeah.
should feel it in your body so you know what they're feeling and when it's uncomfortable, right? Because you know, Manny, you can feel with your hands through a cup the texture.
Oh, yeah.
And I immediately know my client, that's not comfortable. They're like, no. I'm like, so I have to adjust my methods until it
Yes.
feels better.
Yep.
So it's so awesome for body sculpting, but it's cumulative and it's
Yes.
awesome.
Yeah, and on that note, guys, it's not going to be a one session, one and done. This is, again, it is accumulation of sessions. The nice thing is you can see long-term results as long as you're staying fit, well hydration, sleep, and everything else, guys. Don't come and being like, cool, I want to lose my belly fat, come for one lymph drainage of cupping, and actually see your tummy is going to go away in 4 inches. No, but over periods of time, I've had some crazy stuff. But after a period of time, we can help. And what I like to say is we can help unstick that tight fascia that's holding on to that adipose tissue, that fatty tissue, which will then benefit you in your fat loss journey. There's much more to it.
Oh, yeah, we are not. Manny, you're so exactly right. It is not, we are the last thing that people should go to for body contouring. It is the diet, the nutrition, the lifestyle, the exercise, the habits, and then we smooth the canvas that you create. And
Nice.
to that point, we're not removing adipose tissue. That's not either part of it. We are smoothing it so the body moves the material that is naturally inside of it. I work with cosmetic surgeons, and they are the ones that are removing things.
Bingo.
I am working with them to either soften things before or smooth it and restore lymphatic flow afterwards. But if you don't go to surgery, do everything that we just talked about, and then learn that the sculpting is just the complement and the icing on the cake.
Nice. And we talked about us being professionals and doing the proper education steps. Now, again, we see a lot of stuff online, and we see a lot of people just buying from Amazon, whatever the case may be. Is it safe for anyone to do cupping on themselves or their loved ones?
So it's kind of like a many directional answer. It is safe if you do it safely, right? So I had to make peace with people doing self-care when I wrote my first book, because when I was asked to write it, I said, no, I'm not a writer, I'm a teacher. He's like, yeah, but I heard about your classes, and I've been told from people that you should write a book about it, because people are going to do it themselves without training. So wouldn't you want people to do it as safely as possible, right?
Yeah.
So when I wrote that one, because there's that one. This is my encyclopedia of cupping. When I wrote this, there's a little bit about self-care in there, and I know that translated to, like, if I wanted to go home and work on my mother, sure. If I'm not a massage therapist, hopefully you read the book, The Safety, you're approaching it cautiously and mindfully. Okay. But then you had the face cupping that had the videos. This is my self-care face cupping book.
Nice.
A to Z. It's so my mom can do it for herself.
Nice.
Right. And then they have the professional book, so that if people want to do it professional treatment, that's where that one came from, because it's clinical application versus self-care. So now, can you do it self-care safely? Sure. But the problem is, people think if a little's good, more is better. And they're not acknowledging the safety of, like, don't do it every day, right?
Yeah.
Know when to say when. Keep it safe. And I used to train people how to do self-care. I've done that like 5 times in my life, but it was more because of their personal situation. Maybe it was post-surgery, or they didn't live near me. But I mean, some people will say it's just cupping. Who cares? You'll be fine.
Yep.
We're seeing the results and hearing the many people that hurt themselves without without going to a class. If you're not a professional, get a book, please.
Yeah.
Sure, watch the videos, but read. Do yourself the favor to keep
Yeah.
yourself safe as well.
And your loved ones too.
Yeah, everybody. It's all about making you feel, helping someone feel good and not causing pain.
Yep. Nice. Alrighty. So, is it true that the more hydrated the tissue is, the better the experience and treatment will go? How much water should I have the day before, the day of, and the day after treatment?
So hydration is always top
On that note.
contributing factor. Yeah, honey, right? I'm like, you see me drinking my water the whole time we're talking. Hydration is number one. And a lot of times people can have like different ways to see how someone's hydrated. There's intake. Hydration will always help with body work, regardless of if it's a cup or otherwise, because it'll help make circulation and soft tissue more pliable.
Yep.
It will help with the detoxification process of what might be reintroduced into circulation afterwards. And it helps to kind of reestablish the pliability of soft tissue because cups pull fluids to the surface. It has to be replenished on the internal aspect. And Manny, I have my own measurements of water, but I will leave that to your discretion since you are the total package trainer, Manny.
So guys, thank you, Shannon. So realistically, this is what my rule of thumb is. If I have you in the afternoon and you're coming in, because I don't do cupping in the morning, cupping sessions in the morning, 10 o'clock. Okay. So if someone's coming in, I would always ask someone at least has a liter before they come for a session that morning of. The night before, at least 2 liters throughout the entirety of the day, and the following day, at least 2 liters. Guys, our tissue is anywhere from 70 to 82% water. You can look at the watermelon and say we're cousins. We are so based on hydration that every single part of you is connected to water. You guys, I can get really nerdy in here, and like literally your fascia, which is thinner than your hair, has hydration droplets on it when we're going through the microscope. So guys, we are literally doing, so positive pressure is when we push. Okay, negative pressure is what cupping is we're basically moving gunk. We're getting internal hydration to external tissue that is stuck, that is gunk. So the more hydrated you are, the easier the session is going to be on you, the less stimulus that you're going to feel on the body, right? So if you come to us and you're like beef jerky, chances are we're not going to be able to do you're going to get benefit, but you're not going to get as much benefit. Shannon, would you agree with that?
Totally.
Yeah, add anything, please.
Yeah, and so I love how much you advocate the water. I do it all day, every day, right? And our clients, they learn. It's part of that intake in your paperwork. How much water are you drinking? And I can tell touching your skin if you're telling me the truth or not.
Yes.
But there's adverse reactions, right? People can have that. One of the best examples, they start getting cramps because we're pulling fluids to areas from distal like limbs. They get thirsty. Maybe they start getting like some of these less than awesome feelings after body work. People say nausea, lethargy, headaches, etc. That can happen without cupping, but we are vacuuming that fluid to the surface. You see how hydrated and supple the muscle and surface anatomy is after cupping. Where does that fluid come from? We have to replenish it.
Big time. And I'll just add this, guys, if you drank the night before, like you had a good binger, I'm guaranteeing you it's not going to be a fun session. The only way you can balance it out, if you're having a bottle of wine, make sure at least you have a bottle of water.
Oh my goodness. All the conversations we can go in here.
Oh yeah. So guys, take it if you know that you have the cupping session, or you know that you're going to go to a practitioner that does utilize cups, let them know that you did drink the night before. Or if, say, for example, you're going for an evening session and you had a few afternoon delights, or you had a couple drinks at lunch, let the therapist know, because that is going to change how your body responds, right? Especially if you're not hydrating throughout the day. Like if you're somebody, I have less than a liter of water a day, work, and this is from a fitness side of it as well, aim for at least, no matter what your weight is, 2 liters of water a day. I don't care if you're 5 foot nothing, 120 pounds, you still need it for everything else. If you want to have better sleep, you want to have better digestion, you want to have better bathrooms, get your water in.
And can I say, whether it's cups or not, a bodywork session is an investment in your wellness. So don't you want to get the most for your money? So if
Nice.
you're going to be drinking, I tell people the same things. Take care of yourself, or maybe just consider your planning, right? Am I getting body work? I'm going to treat everything around that session as much as I can to get optimal results, because that's what I'm there for.
Nice. All right, guys, we're coming down to our last questions. I've heard from straining and clenching my jaw in the gym or even in my sleep, I can create a lot of tension in my neck and jaw. Can facial cupping help with easing that tension?
So one of the biggest things for me, this jaw region, my history is a pretty significant trauma to my face and my head, and my TMJD afflictions. The negative pressure of a cup is so awesome on the face. All the muscles that clench, the ones that support the process, there's a lot of safety, right? You can easily mark the face.
Yeah,
But
big time.
you can see if I'm working over jaw tension, the relief is immediate. The sensation is so comforting. And again, it's cumulative and lasting, but I know what I'm doing and I don't want to mark my face. But yeah, you allow for, even you can work it and do some mobilization. We were talking about a long time ago, putting it on, stretching the
Yes,
muscle.
big time.
If you work in the front of the neck, please be aware it is only a lift and release
Release.
technique.
Yeah.
Because there are articles that say anything else can be very harmful. Just like my fingers might pinch and manipulate that strong muscle that's associated with jaw tension, we use cups everywhere, and it supports, because the negative pressure, the relief on the nerve endings and those superficial layers of anatomy, and the circulation that boosts. Because I can do positive pressure, it feels nice. Why not lift and make space and allow the body to soften from the inside out?
Absolutely. Nice. And guys, if you do have facial hair like myself right now, they do have to be shaved.
Manny, though, please remember. So I wrote this in the books 2 and 3 because of people like you. So when you have this facial
Yes.
hair, there are techniques that we can mimic with the cup, and I will still get that effect on everywhere that's covered in hair. So please understand, I teach people also how to adapt if there's facial hair.
You're right. You're right.
I'm here for you.
So guys, it's not like someone's going to go and grab this. It's what it is. It's when we have the facial hair, okay, we basically go on the facial hair. And as you can see, I am creating negative pressure off the jaw, right? So is a cup going to be absolutely more beneficial? Yes. And if you're not attached to your beard, it is better to go a little more smooth. It will be better. But Shannon is right. We actually did have this conversation not too long ago because I like my beard. All right,
I'm always
guys.
going to leave that beard, but I can cup the rest of that face. Don't you worry. We just mix it and make it all work.
So last question here, Shannon. Where do you want to see the future of cupping go? And what are your future plans for educating the future cuppists?
Oh, my goodness. So the future is so wide and full of possibilities. I would like to see that the education keeps improving for the better of safety. It's so wild because in the last 10 years, there have been companies coming out of the woodworks, and it's amazing. Some are great, some are not. And unfortunately, it's more because it's about making money and sales and less about education. So I do see that cupping goes in a positive trend, hopefully, because the fad of teach cupping, make money, sell cupping equipment, go go go, that has kind of peaked and lulled, and we're still around teaching it with great enthusiasm and the same results. I see the clinical validation of everything we've been talking improving exponentially, and I see people just really understanding that cupping is just like our hands. If you do body work, cups can be incorporated and they have so much benefit to offer. It's just about how you use them. And so learning, I mean, I have 13 days of course information and I'm creating more every year and constantly just trying to bring people what they ask us for. And cups are one of the greatest tools since the dawn of humanity to the future ahead of us. We all love body work, and cups are one of the greatest tools, in my opinion.
Shannon, literally, we got this in the wrap. So we're closing now with the last 10 seconds. Shannon, thank you so much, guys. Thank you guys for staying with us for the hour. And thank you again. I can't thank you enough, guys. Peace and love, everybody. Bye, everyone.
Bye. Thank you, Manny.